there was a good overall response rate to the immune therapy. It was clearly better than we would have thought from single agent PD-1 checkpoint treatment. So it was over 30%, which was very respectable. The duration of response was excellent. So duration of response was around 18 months, which was very strong. The progression-free survival looked about the same as chemotherapy, which is not surprising for an immune therapy alone combination. So the response rate for the Nivo-Ipi was good, was a little bit better than for chemotherapy. The duration of response was excellent, with about an 18-month duration of response. So overall, a positive result. The safety of the Nivo-Ipi combination was that it was safe and feasible. So certainly when you give combination immune therapy, you're going to have more side effects than if you give a single PD-1 checkpoint treatment. Originally, when nivolumab and ipilimumab was developed, it was developed in melanoma patients. And higher doses of ipilimumab were used, and more frequent dosing of ipilimumab was used. And that combination of nivolumab and ipilimumab was not safe or feasible in lung cancer patients. We did a large phase 1 trial called CheckMate-12, and we carefully evaluated the combination of these immune therapies and determined that if we gave the ipilimumab 1 milligram per kilogram every 6 weeks, that was safe and feasible in lung cancer patients. And this large randomized phase 3 trial confirmed that, and so did a large phase 2 trial, CheckMate-568. So you'll see about 30 to 40% grade 3 or grade 4 toxicity with the nivolumab and ipilimumab combination, which is more than you'd expect, for instance, for nivolumab alone. But less than 20% of patients discontinued any component of their treatment due to toxicity, which was a solid result. And there were no significant more deaths. In fact, there were very few deaths and comparable to the chemotherapy arm. So while the combination immune therapy is clearly more toxic than a single immune therapy, it was safe and feasible and generally comparable to what one might expect for chemotherapy treatment.
So CheckMate-227, looking at dual checkpoint blockade with nivolumab and ipilimumab, is chemotherapy-free, but it's not toxicity-free. If you look at treatment-related adverse events, 77% incidence, although that's lower than chemotherapy, which was just over 80%. Grade 3 to 4 adverse events, similar, 33% versus 36%. And if you look at treatment-related tox leading to discontinuation of therapy, that occurred about 18% of the time versus 9% with chemotherapy. The toxicity that we see with dual checkpoint blockade tends to be early. In my own practice, I've been pleasantly surprised. I think a lot of it has to do with that ipilimumab dosing. Using CTLA-4 in different cancers is challenging, and the dosing regimens vary from disease to disease. This low-dose approach of using ipilimumab at a dose of 1 milligram per kilogram every 6 weeks has been much better tolerated than my previous efforts.
How the CheckMate-227 nivolumab and ipilimumab regimen fits into the first-line treatment of lung cancer is complex, which is good. So we have a lot of good choices now in first-line treatment. So for tumors that have very high PD-L1s, so 50% or higher, and particularly for the ones that are 70, 80, 90, 100%, pembrolizumab alone is an approved therapy, and it can be very effective in that population with minimal toxicity. For other patients with non-small cell lung cancer, a chemotherapy doublet with an immune therapy such as pembrolizumab or atezolizumab are improved, and those are good options. I think that the CheckMate-227 regimen of nivolumab and low-dose ipilimumab will give us an effective chemotherapy-free combination that we can offer to our patients who are not good candidates for chemotherapy, or for patients that, for one reason or another, really want to avoid chemotherapy. And a lot of people, from personal experience or experiences with their families, will want to avoid chemotherapy if they can. And there may be patients who have particular aversions to nausea or hair loss or some other toxicity that's frequent with chemotherapy, where they would really prefer to have a chemotherapy-free option. And I think that the CheckMate-227 combination provides that, and we can feel confident about that for most non-small cell lung cancer patients.